Commissioner of Administration Jay Dardenne is joining us for a little bit. Mr. Jay, how are you today?
Good morning. Doing fine. How are y'all?
Not bad at all. Let's start here, because this is the question a lot of people in our part of the state are asking. Is the ultimate goal of the Edwards administration to remove biomedical research from their association with University Health, or is it to work out the problems?
The goal right now is to work out the problems. BRF has received a notice of breach. They have not received a notice of terminating the agreement. We're complying with the language of our agreement, which requires a notice of breach. That is saying, here are the things that are not being done that we think need to be done in accordance with the agreement. There's a 45-day period to cure those breaches, and we're in that 45-day period, and our hope is that we're going to be able to bring in another partner. This was the request of BRF. BRF asked the governor to work with them to bring in another partner to manage the hospital, and we're in the process of doing that right now, and during this 45-day period, those discussions will be taking place, and they're starting now.
And that other partner would be Ochsner? Is that the direction we're moving?
Ochsner is the partner that's being that meetings are being held with right now. That's right. That's who BRF asked that we deal with, and Ochsner has agreed to sit down and see if it's something that they believe is financially viable from a business standpoint.
Are other partners possible? Is a Willis Knighton a possibility?
No, Willis Knighton is not a possibility. We've said that repeatedly, and I want to say it again today. That is not a possibility. The other thing that is not a possibility, and I was in Shreveport yesterday with the governor, and I want to make this perfectly clear, and we've said this repeatedly. The goal of this administration is to keep the medical school in Shreveport. There is no intent whatsoever to move it out of Shreveport, to move it to Baton Rouge, or anything like that. Our goal is to make the medical school in Shreveport the greatest medical school it can possibly be, and to maintain the safety net hospital to serve the people of Northwest Louisiana in Shreveport, as well as with EA Conway in Monroe, which is running very smoothly and it has no complaints.
So to follow up on that, if there were, say, theoretically, one or two politicians from our part of the state who may have thought out loud that there actually was a, to use their words, plot to get our medical school, you reject that outright?
Absolutely. They're grossly misinformed or either intentionally lying to the people of your community.
Let's talk about the dollars and cents, because State Representative Cedric Glover told us earlier this week that New Orleans and others in South Louisiana, they get the ribs, they get the steaks, they get the prime cuts off the hog, and we get the jowls and the guts. We don't get the prime pickings in terms of dollars. Your reaction to that?
Well, that's just not correct, and there's a great deal of misinformation being put out there regarding the relative amount of compensation being paid to BRF and being paid to University Medical in New Orleans, or to Children's Hospital in New Orleans, which is our partner in the New Orleans area. But the New Orleans arrangement works as it should with a number of other hospitals being involved in medical training. The numbers that have been put out only deal with Children's Hospital's location. It doesn't include West Jeff, Touro, other hospitals in New Orleans that are also involved in medical training. And when you add those numbers in, they're considerably larger than what information has been put out. As a matter of fact, we are in the process of renegotiating memoranda of understanding with all of our partners. We have cooperative endeavor agreements. That's a legal contract with the partners in the state, and we've renegotiated those through memoranda of understanding. The one last year lasted 1 year. It expired on June 30th. We're dealing with new MOUs with our partners. We have agreements with most of them. We still have several that have not been completed yet, including BRF. BRF in this new proposed MOU is being favored more than any other partner hospital in terms of the amount of compensation they're getting relative to what they've gotten in the past. We have serious money problems in the state, as I hope everyone knows, and we're facing this fiscal cliff beginning July 1 of next year. And we're very cautious in the amount of money we're committing to our partners. We want to be realistic about it, but BRF is receiving the best possible financial deal of any of our partners, and we've not been able to reach an agreement on that amount or that MOU that we proposed, which incidentally was centered around bringing in a partner at BRF's request to manage the hospital.
So pardon me, Mr. J. So when you see numbers like University Health, 135,000 inpatient days, $241 million in funding. University Medical Center in New Orleans, only 72,000 inpatient days, but $410+ million funding. Explain to me how that's misleading.
It is misleading because it's incorrect. The arrangement in New Orleans includes multiple hospitals. I'm looking at the numbers right now. The inpatient days for University Health in New Orleans is 197,773 inpatient days. Outpatient visits are 606,029. Emergency room visits are 166,662. Those are different numbers that have been put out, unfortunately, by BRF or whoever else is putting out these comparative numbers, and in an unfortunate attempt to try and both convince the people in Northwest Louisiana that somehow they're being discriminated against. And, of course, it's the legislature that's responsible for appropriating dollars anyway.
Jay Dardenne is the Commissioner of Administration. Let me ask you this, and I don't know if it's an easy answer. If you had to tell us and our listeners is simple, this is complicated for the most folks. What is BRF doing wrong? What do they need to fix now?
It's very complicated. In fact, there's a 13-page letter that has been sent to BRF that outlines the deficiencies and provides, as is required, a list of remedies that's to be provided. And so it's a very extensive list. I can't go through all of it now, but for example, one of the primary ones is to pay its bills. There are creditors that are owed money, and LSU is owed money by BRF in accordance with the MOU that they signed last year, money that had been provided by the state for the express purpose of making those payments to LSU, and those payments have not been made. That's an example that they've got to become current on the money that is owed to LSU and the money that is owed to various creditors.
Is any deal down the line between BRF and conceivably Ochsner or anyone else, does that have to go through Governor Edwards' office, your office, for approval?
Well, it does. We're a party to the contract. I'm the signatory on the contract on behalf of the state of Louisiana. The agreement is between LSU, which is an entity of the state, and the Division of Administration, which is the entity of the state representing the state as a whole, and BRF as the partner hospital. So, yes, we have to sign off on the agreement as well.
Can you envision a deal that would be between BRF and Ochsner or anyone else that the Edwards administration wouldn't sign off on?
No, we're working toward that very thing. Our hope is that we're going to be able to reach an agreement that everybody involved is comfortable in signing off on. That's our goal. That's our objective, and that's what we hope happens. And we're proceeding in good faith along those lines during this 45-day period that's required by the CEA.
Jay, let me ask you that. I'm sorry I call you Jay. I apologize.
It's okay. You can call me Jay.
Senator Tarver has told us he would like to see it go back to where the med school runs the hospital. Are we ever going to see that, or are we going to always be privatized?
Well, I think we're going to have a private partner involved in managing the hospital. I mean, that die has been cast. The state moved away from the old charity hospital system under the Jindal administration, entered into these agreements, most of which are very complex and in many cases, in my view, not particularly advantageous to the state, but nonetheless, we've shut down the old charity hospital system. The employees have been transitioned to the new private partner hospitals, and I think that's the way this is going to proceed going forward. And our mission right now is to try and identify a new partner that can come in and work with LSU and work with the state to make the medical school the best it can possibly be, and to make sure that safety net hospital is providing quality treatment to the people of Northwest Louisiana. And this is another one of the issues that is in discussion right now, is the level of quality and the measures of quality that are going to be provided.
Okay, Jay, you said this was a breach of contract. It was not a cancellation. At what time frame do we get to a cancellation? What do you need to see? How soon before this is a not workable deal?
Well, the agreement contemplates 45 days, and we're in that 45-day period right now where the parties are going to be negotiating. We, in good faith, we certainly are in good faith to try and reach a resolution here, and that's what's contemplated by the notice of breach. It basically says these are the things that are not being done that need to be done, and they need to be corrected. And in addition to those things that are outlined, the negotiation for a new partner is now really front and center in these discussions, because that's what BRF asked the governor for. They asked him to try and identify Ochsner as somebody who would come in and work to manage the hospital, and that's what the governor has done.